Health and Human Services Secretary Robert F. Kennedy Jr. announces the COVID-19 vaccine will no longer be on the list of recommended vaccines for children and pregnant women.
WIFR reporter Alyssa Kelly talked with an area health professional, learning more about what exactly this means for pregnant women and children.
According to the Food and Drug Administration, advisors have been weighing if and how to narrow the COVID-19 vaccine recommendations for some time.
As of today, the COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule.
In a post on X, U.S. Health and Human Services Secretary Robert F. Kennedy Jr. announces the COVID-19 vaccine will be removed from the Centers for Disease Control and Prevention recommended immunization schedule.
That ends today. It's common sense and it's good science.
In a statement from the U.S. Department of Health and Human Services, it says removing the COVID-19 vaccine from the CDC's recommended immunization schedule is part of the Trump administration's commitment to common sense, explaining the pandemic is behind us and it is time to move forward.
I think eliminating the recommendation for the COVID vaccine in pregnant women creates a little bit of confusion.
But Tim Durkee, an OBGYN with UW Health, says the American College of OBGYN still recommends a COVID vaccine.
It's been found beneficial to infants that the antibodies that the mother makes to the COVID vaccine are actually transferred through the placenta to the infant, giving them protection.
Durkee adds, with present data, there does not seem to be a downside to pregnant women taking the vaccine, only an upside.
Patients really need to sit down with their doc and devise the best strategy going forward, if they're pregnant.
COVID-19 vaccines are still available, but experts say that access to the shots for children and pregnant women could become difficult when changes are official.
Thank you, Alyssa. And as of late Tuesday, the CDC has not updated the immunization schedule to reflect the removal of the vaccines.